Good morning guys, myself Dr.Megha Sharotri. Today we are going to discuss on a topic that is hyperthyroidism. Now what is hyperthyroidism? Hyperthyroidism is a condition where a thyroid hormone creates or releases hormone more than your body need. That means there is overproduction of the thyroxine hormone. Now there are two hormones which are responsible or which are produced by the thyroid gland, that is T3 and T4. T3 is triiodothyronine and T4 is thyroxine. Now where does this thyroid gland situated, or what does this thyroid gland do? Now thyroid gland is situated in the front of the neck. It is a butterfly shaped gland, and basically the role of thyroid gland is very important. It regulates the temperature, your body temperature, and it is controlling your heartbeat. It is controlling your metabolism. Now the question arises, who get this hyperthyroidism condition? Now the answer is anyone can get this thyroid condition, or we can say hyperthyroidism, but females are more prone to get this disease or to get hyperthyroidism. Now what are the symptoms of the hyperthyroidism? The main symptom of hyperthyroidism is a weight loss. Increased weight loss we can see in the patient. Next we see there's increased appetite, diarrhea is there, tremors are there, palpitations are there, the skin of the patient is feel calm and moist or calmy skin we can see. The patient is very restless, and the patient is there is so much sweating of the patient. Now sometimes we can see in the enlargement of the neck is there, or this condition is basically seen in the goiter. In the goiter condition we can see there is enlargement of the neck. Now what are the causes of this hyperthyroidism? Number one is Graves' disease. Now what is a Graves' disease? 85% of the hyperthyroidism patient are coming from this Graves' disease. 85% of the patient are suffering from Graves' disease who are hyperthyroidism, who had or have hyperthyroidism. Now what is a Graves' disease? It is when your immune system attack on your thyroid gland. Due to that there is overproduction of the thyroxine hormone. Now next is thyroid nodule. What is a thyroid nodule? That is also a main cause of hyperthyroidism, in which there is a extra growth of the cells seen in the thyroid gland. This is very rare condition. Very rarely patients suffering from this thyroid nodule condition. Now next is thyroiditis, that is an inflammation of the thyroid gland. Now what are the main tests through which we can know that the patient is suffering from hyperthyroidism or hypothyroidism? Number one test is thyroid profile test, where the levels of T3, T4, TSH hormone, TSH means thyroid stimulating hormone, we can test. In the hyperthyroidism patient, we can see that the T3 and T4 is increased and the TSH, that is thyroid stimulating hormone, is decreased. Next is radioactive iodine uptake. This is also a test by which we can know whether the patient is suffering from hyperthyroidism or not. Next is ultrasound of the thyroid gland. Now if the thyroid or hyperthyroidism is untreated, then there are so much of the problem which patient can suffer. Number one is a heart failure. Next is atrial fibrillation. Third is stroke. Number fourth is osteoporosis. So these are the conditions by which, if the hyperthyroidism is untreated, then the patient suffering from all these conditions. There are so many conditions, there are so many treatments for hyperthyroidism are there nowadays. You can take allopathy treatment as well as you can take homeopathy treatment. So there are so many treatment nowadays we have. Thank you so much.